Hmm.
This
Now it's
call is now
started.
being recorded.
Dr. Geeta, please go ahead.
Okay. Om Dhanvantre Namaha. Good afternoon to dear all Vaidyas. Myself, Dr. Geeta Puttur. I am welcoming you all on behalf of RAAAOUS to this webinar. We have successfully completed 35 webinars. Today is the 36th webinar series. So I request everyone to mute the gadgets to avoid the interruption in between. So before starting this session, I request Dr. Veena to start the Dhanvantri Stotra.
Thank you, ma'am. Good afternoon, one and all. Om Shri Ganeshaya Namaha. Namami Dhanvantarim Adidevam Surasurairvandita Padapadmam Loke Jararubhayamrityunashanam Taramesham Vividaushadinam Dhanvantari Ramanatham Sarvaroganivarakam Ayurveda Pravaktaram Vande Piyushadayakam Sarve Janaha Sukhino Bhavantu Om Shanti Shanti Shanti. Thank you.
Thank you, Dr. Veena. Now we are going to listen one more melodious voice by Dr. Sribala. Welcome you, ma'am.
Thank you, thank you. माणिक्यवीणाम् उपलालयन्ती मदालसां मञ्जुला वाग्विलासा माहेन्द्रनीलद्युति कोमलाङ्गी मातङ्गकन्यां मनसा स्मरामि मातङ्गकन्यां मनसा स्मरामि.
Thank you, ma'am. Thank you, Jayashree ma'am, for saying this. We are not knowing that Bala ma'am knows very well the sounds and all. Thank you, ma'am. Now I request Shakuntala ma'am to say few words about our RAAOUS and intentions. Welcome you, ma'am.
Namaste all. Om Shri Dhanvantriye Namaha. Myself, Dr. Shakuntala Patil, founder of this RAAOUS team. I welcome all of you for this beautiful webinar of 36th RAAOUS team. Today, actually, we are happy to have Jayashree madam, very senior person with us. Thank you so much, ma'am, for joining this webinar. I thank Sribala ma'am being a part of RAAOUS team, and she is sharing today her knowledge in spite of her busy schedule. Thank you so much, ma'am. RAAOUS is Rudra Arbudha Ayurveda approach under one shell. As name suggests, so for Arbuda, as Asadhya Arbuda, which one I usually say in my UG time, so now it is becoming Rudra Arbuda, which is Samhari. So for this noble cause, more than 350 Vaidyas are in our RAAOUS team, and apart from that, 14 state Vaidyas are in our RAAOUS team, and we are doing a treatment discussion. We are having 2 classes weekly. Once in on Monday, that is 9 p.m. We are purely discussing on yogas, rasa yogas, or some one specific yogas or a disease. And in Thursday class, 9 p.m., we are having two classes. In Thursday class, we are discussing on one Arbuda. Every week, this is Ross. What is the Ross doing? That what I am introducing right now. And we are having educational trips. We will go to Vaidyas and we learn from them. We discuss what we are doing. And second thing, the third thing is that we are started our own preparation for our own friends. And recently we have started a one group called Farmers and Ross Collaboration to avoid pesticides and nidan of all the disease, that is food. Whatever we are getting so much of poisonous food. So we have just started yesterday. We had a one meeting, new thing added to Ross group, and we are conducting awareness offline and online awareness programs about Dinacharya and Rutucharya to avoid cancer. And in spite of that, we are also conducting screening camps. Multiple screening camp happened in July month at their own clinic, and we got very good response. And along with that, we got very maximum cases of adenomas, that to breast cancer, breast and oral cancer we conducted. More than 20 clinics we have conducted. There we got good response from public also, and shocking results from reports also. That is both the sides. And in spite of that, so many are working behind this ROS team that we called as admins team. And Gurukul team is taking care of webinars. Once again, I welcome you all and hand over this seminar to Thank you.
Thank you, ma'am. Now, Dr. Amulya will introduce today's speaker. Over to you, Amulya.
Hari Om Dhanvantri. Namaste and a very good afternoon to one and all. So, I would be giving a brief introduction about our eminent speaker today, Dr. Sribala. So, Dr. K. Sribala, she has done MS Ayurveda. So, first she completed her BMS from SCS VMV in Tamil Nadu. And later on, she has done her PG in PTSR from NTRUHS Andhra Pradesh. So, she has also worked for Rasashastra and RBSK team as a team lead. Also, she is a visiting consultant in NTPC, Simhadri, Visakhapatnam. She is a managing partner of Dhatri Ayur Care, a holistic Ayurvedic hospital in Visakhapatnam. Now, she is also working for Samvardhini Nyas Garbha Sanskara program. And these are all her work experience. Coming to her achievements, she has received International Best Researcher Award from JSSN International Award, World Research Council in 2022. She has been selected for gold medal for best academic performance in MSIU from NTRUHS Andhra Pradesh in 2022. She has also been awarded for best poster presentation in Kashyapi organized by KAGAF Hyderabad in 2018. She has received meritorious award from Alumni Association of SJ Ayurvedic College, Chennai in December 2018. So many accomplishments, multi-talented doctor we have today here. Again, she has received a silver medal for academic excellence in BMS from SCS Vishwa Mahavidyalaya, Tamil Nadu in 2010. Along with this, she has also received Ayur Visharada Merit Award from Himalaya Drug Company in the year 2010. She has presented so many presentations, papers, and posters also she has done. To name a few, she has presented a research paper entitled Role of Uttarvasti in Regulation of Hypothalamo-Pituitary Ovarian Axis. So this is a very new thing for us because usually Uttarvasti, what we think, it is for local uterine conditions, whether some issues related to uterus or tubes or ovaries. But very good to know that it can equally have a great effect on regulating hypothalamo-pituitary ovarian axis. We might want you to talk on this one day, someday, doctor, for us. Kindly address on this.
Definitely, definitely.
Yes. So usually, I mean, all these papers are so unique, whatever you have presented. So it was submitted in International Ayurvedic Medical Journal in November 2021. So she has also presented a paper on significance of lactation in Stanyamrutam conducted by NTRUHS in 2021. She has also presented paper on Garbha Samskara in Kashyapi in the year 2021 again. So there are so many other papers she has presented for geriatric disease care, importance of stanya in Ayurveda, preventive medicine, gynecology, then preconceptional care, so on and so forth. She has been certified. She has a lot of certifications under her. So few to name: Samsiddhi 2021 International Conference organized by Ayurveda College, and many more. So I can keep on going. So we are very glad to have you, and I believe today it's going to be a very knowledge enriching session. And once again, I welcome you on behalf of ROS team. Welcome, Dr. Sribala.
Thank you.
Nam- Namaskara. I am Dr. Sribala. Thank you. Earlier, speaker was saying something, but I am still a learning Ayurvedic doctor. Through my journey, it's a Mahasamudra. I am just in getting a drop and drop of it through people who are met through. Today, I make a little, it's a little trial from my side that I explain on cervical cancer, carcinoma, and Ayurvedic view. Um, a small introduction by the numbers. What the present update says that it's cervical cancer is third most common among gynecological cancer, whereas on globe every third woman dies of cervical carcinoma. Though it is a secondary or the primary diagnosis, every third woman dies. Every 68 seconds, one woman dies of gynecological cancer, globe says. Whereas 75% of decrease in occurrence is noticed on date as per the statistics of 2020. The study says like occurrence and death from cancer is just decreasing on the base of screening programs and diagnostic techniques and early diagnosis. This is over work of 50 years. They could achieve a little. And what do the contemporary science stand today? It's a huge work going around. All medical sciences work on carcinoma very seriously. And where do the contemporary science stand today is they finally concluded HPV vaccine is very effective in preventing a precancerous and cancerous stage. Once she is diagnosed with an invasive one and vaccine is no more useful, whereas 67% of deaths, cancer deaths occur only in elderly people as per the statistics. So they advise additional immunotherapy in initial stages, whereas locally advanced cervical cancer could be treated with that along with the adjuvant therapies and co-chemo and radiation therapies, wherein where it comes to recurrent and metastatic stages, it remains a therapeutic challenge again. So this is a brief study on what is the statistics on globe now. Cervix uteri among all other cancers is 9.4. It's not a bad number. It is only the diagnosed one. As far I understood, many cases are kept undiagnosed, and because it is a vaginal procedure and diagnosis is a very as a private one for a lady, I think half of the numbers are kept undiagnosed. So, what Ayurveda refers to such disease? Do we have any name called cervical cancer in Samhita? No, we don't get it in the same name, but even the Sanskrit terminology, the same transcription also will not be available. Translation will not be available because we always have a unique statement that Vikaranama Akushalo Najisriyat Kadachana because we have the greatest answer for the diagnosis and management principles and simply for naming a disease is not a problem for us. But the clinical presentation, observation, the diagnostic procedure, and all other phenomenon happening around the cervical cancer could be given as a nomenclature with the different entities in Ayurveda. According to Sushruta Samhita, the Grandhi could be Apachi, Arbuda, Gulma, Visarpa, and so on, where the Doshadusha Sammurchana, the Lakshana, and the Samprapti, the Vyakti, Veda, every stages, in different stages, we can see the similar conditions of cervical cancer. So, to understand cervical cancer in that way, in according to our science, what are principles should be understood to name it as a cervical cancer? The basic thing is Vayuhu Vibhajati. According to Tejaha Yenam Pachati Apaha Kledayati, the Panchamahabhuta theory inside the intrauterine life of a woman formed. There itself is the responsible factor, the Vayuhu Vibhajana, the cell division, the hypoplasia and hyperplasia, both the things happens through Vayu. That is which Vayu in further slides we can go through. And one factor is Vata. The Panchavata, where it is lodged in. We can just discuss how Pranavata is responsible for cervical cancer later. But as for this, if the gene is formed and that is being divided into a particular number of cells which is necessary for the growth of the baby, that is whole and soul is Vayu. Then next is the Rasavaha Srotasa Moolam. We know Apachyapada, that is Artava and Stanya, both are Upadhatu of Rasadhatu. Rasavahanam Srotasa Moolam, Hridayam Moolam, Dashacha Damanyaha. When we see Artavavaha Srotas also, it is Matena Upachitam Kale Damanibhyam Tada Artavam Punaha. That is the only marga where Artava should be getting out. And that Apatyapada and Artavaha Srotas is completely nourished. It is Upadhatu is not just formed out of it, but is maintained and nourished by the Thayi Dhatu. The original Dhatu is responsible for that. So, whatever the Dushti caused in Rasavaha is responsible for the Dushti of Artavaha Sroto Dushti also. And then, origin of organ, the physical study. The uterine musculature, where it comes from the mesoderm. The breast layer and the uterine body, the total musculature forms from the mesoderm, second germinal layer, and where it is more prone, which type of dermal layer, germinal layer is responsible for which type of gene mutation of carcinoma is very, very interesting to understand carcinoma cervix. Then Bija Dushti, relatable to the forthcoming disease. As we say that Vaina Bahusho Binaha, the Bija Bhaga and Bija Bhaga Avayava, which is getting differentiated at different conditions and at which level it causes Dushti to the particular body is responsible for that what it may be a carcinoma or whatever the similar disease, if that part is affected and the post-coming life of the baby is affected in the same way. Just I have given this cancer cell division for a pictorial understanding. To be in a nutshell of a statement, a normal cell, it takes a birth, it grows, and it matures, and it dies. This is the original life of a cell. Wherein a cancer cell, cancer develops because of a complicated interaction between our genes and the environment, and it takes the chance of vitiated factors also. So that is somewhere around. It keeps on growing, but there is no death and no purpose of function also. A small samprapti of Arbuda I have given some samhitas, which all the doctors will be knowing this. I am just brushing it up, that's all. Due to Nidana, it is a Tridoshatmaka Vyadhi, where it takes the dushti of Dhatu Agni of Mamsa and Meda, where both the Dhatus are not nourished on par with the functional. Karma is not done properly. Guna is there, but it is Adhika Guna. It's not a purposeful Guna of the Mamsa Dhatu and Meda Dhatu. Where if it gets localized in Garbhashaya and if presented as a local swelling, that it is Grandhi. If presented as a Pakavastha, then it is Apachi. If presented as a complete Dagda Avastha, that is a Vasarpa. If it is completely of Tridoshatmaka condition seen in the same place, that it is Arbuda. See, this is a small classification I tried to make according to the presentation of the patient. Uh, in the initial stages, where every disease is out of Amavastha, because it is Amaya. Amaya is formed out of Amavastha, imbalance of Agni, that Agni Dushti causing Pitta Kopa. Due to that, it is a Vidagdajirna, which causes Prakopavastha directly. I mean, Sanchaya would happen, but Prakopavastha is more, uh, is very pronounced to see. Whereas in Kapha it is Chiravriddhi Apaka. It is a Mandaruja and growth is also very slowly, Chiravriddhi, and it is Apaki. So, it reaches the reproductive system and blocks the Apanavayu by the time of Prakopa. So when it comes to Prasaravastha, it weakens the Mamsa Dhatu and it causes Dushti of both Sai Dhatu and also the Upadhatu. Sanya and Artava both get Dushti out of it, where by the time of Vyakti, it manifests all the clinical features, and by the time of Veda, all the other Upadrava happens. Here it is the a small treatment line in a nutshell I have given Vataja Arbuda Shodhana. Pittaja Arbuda Raktamokshana. It's in the sense, it's not a light down rule that every Vataja Arbuda should be given a Shodhana. It's according to Samhita what it is given. It is a Samprakti Gataka. Vataja Arbuda is given a Sneha Yukta Kashayapana. Interestingly, many patients being in Arbuda condition, cervical cancer, once it is diagnosed and underwent hysterectomy and found with secondaries and any other tissues, if they go with Snehapana for 10 days and go for a chemotherapy, is being with less side effects of chemotherapy and radiation. And Pitta Arbuda, where Gritapana is given as a Vicharina Sneha, everyday Gritapana. Where in Kafaja Arbuda, it's a completely Kshara application, Vamana Virechana, Tikshna Shodhana is needed for Kafaja Arbuda cases, where in Medoja Arbuda, Shodhana is the only way. Above all these, Shastra, Kshara, Agni, Karma, according to the dosha dosha samurchana and the amshamsha kalpana of the doshas, which dosha is in which ratio form, and age of the patient, and dosham, dushyam, balam, kalam, analam, prakriti, vayaha, sattvam, satyam, tada, ahara, avastha. Everything should be kept in mind. All the practicality should be taken into effort for applying Chedana, Vedana, Karma. If all the dosha dosha samurtana happens as said in the earlier slides, the clinical presentation would be the same. In Vataja Arbuda, it is a hard and multiple growth in cervical region. Like when you see in a PV, like outer cervical region, that erosion will be there, and there is a small growth which is hard, is typically find in PV examination, wherein the patient complains of symptomatically dysmenorrhea, dyspareunia, and pelvic pain. In Pittaja, it's a rapid growth, it's a menorrhagia and irregular menstruation. Irregular menstruation here I mean to say even in a postmenopausal bleeding is also irregular pattern of postmenopausal bleeding is seen in Pittaja condition. Where in Kaphaja is the larger in size, it's a bulky uterus kind of adenomyosis conditions, even the benign fibroids being multiple fibroids, and everything comes under this delayed growth. So that is, they people have classified it as a benign one, but for us, if it is a growth of abnormal pattern, it is a arbuda. Then heaviness of abdomen and pressure symptoms, it is a as symptom like an iron ball kept in the pelvic region is typically EVA kind of clinical features presented by the patient. So after all these diagnosing in a proper manner and everything, Ayurveda have a solution or not? Yes, we definitely have a solution. Here, self protection, I mean to say it is a dhatu samya. Dhatu samya kriyasya yukta tantrasya asya prayojanam. We see what we are doing in a present scenario. Diseases like cancer, HIV, hematological abnormalities, autoimmune diseases, everything we understand in a different morphological modalities, not in the same way. For example, emergencies like epistaxis cannot be taken as an emergency by us. For a small measure like Haritamanjari or Durvanasya, will take care of epistaxis for us, hematological abnormalities. But epistaxis, finding a root cause is a far one. Nearer one can be managed by us. So the emergency as an emergency understanding in Ayurveda is a different thing. And the complexity of the disease at every level, staging in cervical cancer 1A, 1B, 1C, whatever it is, on par understanding it's a dosha and the prakriti of the person and the dhatu agni dushti is the only stages for us which is treatable or not treatable, or along with arishta lakshana or not along with arishta lakshana, or what is the lifespan uh, can be assessed to the person according to the samhita is the only complexity of the disease for us. And on therapeutic base, this is a study on 2020 based study I have given here. 2.4% of the patient increased their survival for 5 years after diagnosis with the altered, what to say, without chemo and radiation. They have taken herbomineral compositions and um, any all other kind of alternative medical therapies with all other kind of therapeutic base. 2.4% have increased their survival for 5 years at least. And proving all these in a scientific manner, we should little have a drug research of very expensive thing, and preventive module should be modified in our shoes, like in our parameters of Ayurveda. If we can prove in a scientific way, that would be more useful for us, for the patients too. And the first part, Swasthasya Urjaskaram, preventive measures is to avoid environmental pollution. Here I mean environmental pollution is strictly about sanitary napkins which are made out of plastic and more of polyester usage by the female. Many other plastic stored things taken, carbonated foods taken by the female. And what are all the environmental causes like used by the artificial and synthetic kind of things which are not natural or consumed by the lady are found to be BRCA1 and CA2, BRCA2 gene mutated oncogenes by the present day study. American Association of Cancer Research says the same. Even Indian study, all over the globe, the same problem prevails, and we are a bit better that we have organic things to use it, so at least to avoid chemical fertilized and fertilized food directly to the female. I mean, for everyone, but for our topic today, it's a cervical cancer. It's a direct oncogen of vegetable fertilized food. Then cooking modulation to avoid oncogenic factor. Here I mean to say microwave cooking foods and reheating foods. Today we take stored in tin or reheated foods. Acharya says that yata yamam gatarasam puti paryushitam chayat. Puti paryushita is nothing but an oncogenic factor. So the food after 3 hours, one yamakala, is always not good for healthy lifestyle. A lifestyle modification here, I mean to say, is a late night sleep or which alter the uh, circadian rhythm of the female, which be the oncogen for the future generation. If the lady is working for all the day and she sleeps late at night and she doesn't have a, peaceful life, very stressful life, so that leads to altered circadian rhythm of her cycles and her menstrual cycle is disturbed. And this will be a gene mutation cause of oncogen for the baby, future coming female baby of her own. And to improve the immune response of the baby, body is the next level. Like once diagnosed with carcinoma or in an elderly age person and the lady with in a reproductive age like perimenopausal and premenopausal ages, they should be provided with proper immune response of the body. And to go with nature as much as possible is very, very easy preventive measure to avoid cervical cancer. After knowing all preventive measures and diagnosis, if the patient comes to us and asks, I have tried all the pathis across the globe, so now Ayurveda is the only solution for me. So we cannot do any magic, I could say. We can do, we can only classify the patient into this umbrella, whether it can be Sadhya, Kritra Sadhya, Yapya, or Anupakrama. Sadhya is, we can do it in initial stages of cancer. If it is of dosha samya and dosha samya is to be properly seen, if she is of a Kapha Prakriti person, if she doesn't have any Arishta Lakshana, then she can be managed with Aushada, Mani, Mangala, Aushada, every kind of Shodhana procedures. Kritra Sadhya could be added, like present day scenario, we can add even Panchakarma, Shodhana therapies and surgeries is needed. Yapya is even after surgery, we can just have to maintain, but this comes under asadhya condition. We have to hope counsel the patient that this is the way you have to take care of your immune response in the future life. Where anupakrama is the metastatic condition where we cannot as such manage the case, but we can give life to her next years with just herbomineral compositions we have that we in next slides we will come out about it. If it is very much treatable in Ayurveda, cervical cancer, if it is very much treatable in Ayurveda, how it is actually taken into consideration? Then why can't be a main line of treatment, mainstream of treatment for cervical cancer around the world? Is because we are understood as adjuvant or co-therapy for chemotherapy or radiation, or we can manage to slow down the progress of the disease, or with our medicine definitely we can do this is an anti-tumorous action and cell protection, regeneration of the new cells and protection of the surrounding normal cells, and then is the dhatu samyata. These are all the things one ayurveda can do if there are many processes of control that a cell growth and division can do, and several of these control mechanisms can be affected from a cell becoming cancerous. So that can be done with all these five procedures as the adjuvant or co-therapy. Uh, so normal body cells growing, dividing, and dying fashion can be restored with all these five patterns. Then the factors to be considered in the adjuvant and co-therapies. What are all adjuvant and co-therapies we can do is we can just give them internal medication as an adjuvant and co-therapy, which is indicated where a patient is actually not recommended for chemotherapy as per the age or as per the economic condition or such a condition, we can give it as a adjuvant and co-therapy. And to slow down the progress is the actual management. Is the actual objective of the management is to slow down the project process of carcinoma. That we can do through when chemotherapy, radiotherapy, and are contraindicated due to many reasons, and patient have no other chance and comes to us. There we have to go for to slow down the progress of the disease. Wherein anti-tumoral action with the help of actual herbomineral compounds we can do anti-tumoral medication, and for cell protective activity to improve the quality of life where the actual part of rasayana comes in ayurveda, wherein immune development can be done through the rasayana therapy, the use of antioxidants during chemotherapy and reducing the generation of oxidative stress induced by all these aldehydes given by the chemicals. During medication, the factors to be considered are the drug regimen according to the constitution and the drug regimen according to doshavastha and the drug as a whole. Why I particularly mention here is the see, for example, curcumin is very strong anti-oncogenic drug is very, very famous all over the world. But alkaloid or flavonoid extracted out of it will not be anti-cancerous. Curcumin as a whole is a anti-cancerous drug. So Ayurvedic drugs should be as such in different forms what Acharya meant to in a Kalpana Vishesha like Kashaya, Swarasa, Kalka. In Panchavida Kashaya Kalpanas, in that particular form, according to the constitution, Prakriti of the and Dosha Avastha of the patient we have to go through, but not drug in a different alkaloid and flavonoid forms. And the factors should be considered for a treatment is chronicity of the disease. एक वर्ष पूर्व is the Asabja case, I mean Yapia case when it comes to cervical carcinoma. Then the target of the disease and how we treat the case is control of cell division, promoting apoptosis. Apoptosis is the process where I have seen cell and cell division procedure will have different stages. Apoptosis is the first stage of it. How will cut the abnormal cell division is through augmenters like Brahmana and Shamana. Like Shamana, Aushadha, and for tissue, improving tissue immunity, fortifying defense of a particular target tissue. If it is a metastatic condition, then it should be Langana and Shodhana. How we can actually divide these medicines as the Langana Shodhana or Brahmana Shamana is my understanding. I have written it so like absolute Brahmana is Madhura Rasa, Prithvi Jala, where you can give in a metastatic condition for an elderly woman even after undergoing chemo and radiotherapy, whereas the patient with Vata Prakriti and Pitta Prakriti, where you have to go for relative Langana and relative Brahmana. Absolute Brahmana is not indicated in a Kapha Prakriti person, so we can go for Prithvi Agni Bhuishta Amla Rasa and Agni Jala Bhuishta Lavana Rasa Brahmana, where it is not absolutely Langana or absolutely Brahmana. In future slides, we can discuss about what is the Ishad Brahmana and Ishad Langana drugs we actually taken into. And for Kapha Prakriti and with elderly, not that much elderly age persons, the reproductive age people with a background of thyro complications and all, we can have absolute Langana with Agni Vayu Bhuishta Dravya, where Akasha Vayu Bhuishta absolute Langana with Tikta Rasa, especially in metastatic condition in a Pitta Prakriti person, and Kashaya Rasa, where uh, the persons with Pitta Kapha Prakriti. Pitta Kapha Prakriti of Vayu Prithvi Bhuishta absolute Langana is indicated. See, I have in my own practice and with my elders, like with my teachers and who are they practicing, we have classified on some 10 number of drugs for our times, which are proven anti-oncogenic and very helpful in present day practice for treating Arbuda alone. That is Shatavari, Ishtimadu, Kumari, Amalaki, Bhumi Amalaki, Ashoka, Guduchi, Bhallatka, Triphala, Mandishta. Uh, it's not that Haridra is not mentioned here, but Haridra directly cervical carcinoma cases as such as a medicine we are not applying in cervical carcinoma cases. We are just indicating the patient take it internally with the milk. So, as per the cases of cervical carcinoma, Shitavari should be understood as a Susnigdha, Shukrala, Balya, Sanya, Medhya, Agni Pushtida. So, wherever all these drugs are rasayana, but each and every drug have a special character. Like where Shukrala is to be taken, where Balya is to be taken, where Medhya is to be taken. Here we have to think about hormonal imbalance induced cervical abnormalities. Cervical abnormality as such due to UTI or due to any other local reasons is very less number noticed. Cervical cancers or cervical hyperplasia or whatever the cervical abnormalities noticed in present day sciences are lot due to hormonal misaxis or the axis lost between hypothalamo-pituitary ovarian axis. This happens due to neuroendocrinal tumors in brain. Though it be very small in size or very less years of chronicity, but it produces the interleukins which are responsible for the hyperplasia in cervical region. So every gynecologist will accept with the same that there is abnormality of hypothalamo-pituitary ovarian axis in cervical cancer. So Shatavari being major rasayana, at the same time it's a Shukrala. Shukrala here doesn't mean a Vrishya or Supravriddhikara Dravya. It should be understood as a Artava Prasadana Dravya. So the Artava Dushti is Artava Vaha Sroto Dushti is also treated with Shatavari. The next comes is Eshtimadu. Eshtimadu Kshirapaka after chemotherapy is being a Nitya Rasayana in many patients. Eshtimadu is a very good glucocorticosteroid according to the modern people. And Kumari is a Grandhi Agnidagda Vispota Pitta Rakta Amaye Rasayani. This is the condition specifically seen in any carcinoma. Grandhi Agnidagda Vispotavat Pitta Rakta Amaya. This is nothing but carcinoma, which is Kumari is being Rasayani in that particular. Generally, doctors understand Kumari as a Rajapravartana Dravya, Ushnavirya. So, after being Samskara, it could be Ushnavirya, but as such, the drug is a very good Rasayana in Grandhi Agnidagda Vispota or Arbuda conditions. Then Amalaki, Bhumi Amalaki is Vrishya Balya Rasayana. Of course, Bhumi Amalaki both are Vayasthapana Dravyas. Amalaki is a Vayasthapani by its Prabhava. Vayasthapana here doesn't mean just being operating. Vayasthapana here just doesn't mean. Am I audible?
Yes,
Hello.
ma'am. Yes, ma'am.
Got a message, ma'am, like,
Here means the
no, ma'am.
cells
Got a,
being restored.
Ma'am, sorry to interrupt you. Hello. Can you say loudly little bit?
Hello.
Can you say little bit loudly, ma'am?
Hello. Is
Yeah,
it
ma'am.
audible?
We can hear you.
Yeah. Thank you. Yeah. A small signal disturbance is okay. Amaliki Vayasthapani here means the cell restoration from the Pakavastha. The cancer we understand as the abnormal cell growth in an abnormal style. In the abnormal pattern, hyperplasia and hypertrophy both are seen. So restoring back and streamlining the cells for the normal growth is nothing but sthapana. Star Dhatu is itself is the restoring and maintaining the streamline that is attributed to the Amalaki, where Bhumi Amalaki is very good understood as a liver functioning drug as per the local understanding. But Bhumi Amalaki equally have Vrishya Balya Rasayana property, whereas Ashoka, I just categorize in such a way that Vata Pitta Dikya and Vata Pitta, and then comes to the Kapha Dikya and Kapha Vata Adikya in that manner. So Ashoka now comes as the Shosha Apati Trishna Daha Krimi Shobha Visha. Krimi here indicates the kapha intervening into the carcinoma conditions, where we see in all HPV cases there is an intervention of uh, viral load into the patient. So here we understand it as a krimi. So the cases presenting with Shosha, Apaji, Trishna, Daha, all cervical carcinoma with this condition, and Asrajit, all these conditions along with Asra dosha, is Artava dosha, is treated with Ashoka. And then Guduchi is Swadipaka Rasayana, everybody knows, but Kamala Vata Astrip Dwarahara. Vata Astrip, here he says Astripdara of Vata predominant should be treated with Guduchi, whereas Ballataka Trifala Mandishta or Ballataka Tikshnoshna for Chedi Vedana. Ballataka is taken as a surgical drug in Ayurveda as per my understanding.
You need not take any other surgical blade and take out any or cut it down for any excision and incision purpose. You can easily use Bhallataka as an anti-cancerous drug. Wherein Triphala and Manjishta, it is usually indicated in Raktatisara and Kushta, Astra, Visarpa, Vrana kind of condition, which is clearly seen in metastatic conditions where Rakta Shodhana is also needed. The Dushti is all the way gone to from Artava to Rakta and also Mansa Medo also. So, extended use of Triphala and Mandishta will have a good result. All these drugs, as I mentioned, a single drug prayoga is all will be enough as a rasayana for a long standing use, or you can make it as a your own compositions like Kshira Paka is very much useful, where Kshira is Jivaniya and Rasayana, along with the drugs will helpful in the any carcinoma condition for extending their life or to stop the neoplastic conditions or to stop the progress of the disease. Then comes the compound medicines, a few medicines which we use in carcinoma cases very usually. I think every doctors of our this group will be knowing very familiar with it. Mahakalyana Grita. Why only Mahakalyana Grita? For that matter, why only this number of 10 drugs where many other can be noted as anti-cancerous, or there are many other brands which come with anti-cancerous action. See, these drugs have a peculiar action where we should divide the patient according to our principles, like whether she is a Vataja Arbuda condition or Pittaja Arbuda condition, or we should take it as a Dhatu Agni Dushti. In that particular manner, if we categorize the patient, then we definitely have to take these medicines into consideration. That is Mahakalyana Grita Sreshteshu Sreshtam Pumsavaneshu. Here the Pumsavana is not just installation of uh, what to say, a milk into a woman for getting a male child or some other understanding which an incomplete Vyakhyana says about. Here the Pumsavana means the proper division of the Purusha inside the Garbha of that particular woman. If the Mahakalyana Grita given as a Snehapana, Vicharana Snehapana for a woman, by any chance they don't will have any possibility of getting carcinoma in future for that baby inside the womb. Aretati aprajati. So if the formation of retus is the problem, or if conception is the problem, or fertility is the problem, whatever it is, the name itself is Kalyanaka. So the Rasayana Bhaga and Vadikarana Bhaga and also Vranaropana Bhaga is also taken care of by the Grita. And then comes the Panchamrita Parpati. Panchamrita Parpati, any Parpati is very well known for Achushana Prakriya. Parpati, it takes out the excessive fluid exudents given by the Brana or whatever the abnormal fluid metabolism of the body is taken out by the Parpati. For that matter, Panchamrita Parpati is Vanni Pradipani. Which Vanni Pradipani it is? It is Artava Agni. Artavaha Sroto Dushti happens. So that Sroto Agni is corrected by the Panchamrita Parpati. And Shilajitu Rasayana, this is the what is a by Prabhava. Every doctor knows Shilajitu as an anti-cancerous one. But Shilajitu, in which form is being anti-cancerous, or which form is taken by a Prameha Pidaka, or which form is taken as a Vadikarana Dravya, is very, very important. For a carcinoma patient, Shilajitu Rasayana is given along with the Gugulu and with Kshira Anupana for 40 days for a Mandala Kala. Very senior doctors practices in the same way, which we follow from them, is Shilajitu and Gugulu along with Kshira Anupana for a Mandala Kala is very good in cervical carcinoma to arrest the neoplastic conditions and also slow down the progress of the disease. They comes under the Samira Pannaga Vanga Vasma. Here is the latest study, is a very recent study in PubMed says that Samira Pannaga Rasamanikya, arsenious trioxide, they are responsible for maintaining the apoptosis process of the cell, being a very promising challenge in anti-cancerous drug preparation nowadays. So, the drugs like Rasamanikya mentioned here and Samir Pannagrasa is very, very useful in as a rasayana purpose to give as the adjuvant therapy after chemo even and as a part of radiation even. This is a very good medicine where you can arrest the cervical carcinoma cases. The very best part of it is Gandhaka Rasayana adjuvant toward to being aware for a ropana of the Pittaja Arbuda cases. And Abha Gugulu in the case of Vataja Arbuda cases where the Medo Dushti is also added to that. If the Gugulu is Vata Medo Hara, so Abha Gugulu will take care of the arresting of Vataja Arbuda condition. And the best Kashaya for my practice is Varanadi. Arbuda Nashana is the Abhyantra Vidrati should be treated with it. Varanadiko, you know all Varanadi drugs and what it does. But Varanadi as such can be taken as a radiation drug. The patient with cervical carcinoma will have following symptoms even if they go for treatment or for chemo or radiation or with as such for the disease they will have certain conditions which could be treated with the parallel drugs. In my practice, we practice the same in our hospital, like drugs for symptomatic relief. If they have pain predominantly, then go for local Svedana. Svedana in cervical region is not possible. We do Yoni Prakshalana with Panchavalkala Kashaya and Abha Bugulu is internally administered. Whereas in nausea and vomiting is very predominantly seen in chemo and radiation undergoing patients where Sutasekar Rasa and Vamanamrita will take care of. HPV recurrent infection. This should be treated with Mahalakshmi Vilasarasa if the patient is of Kafapitta Prakriti. And if the patient is of Kafavata Prakriti, we just go with Gandhaka Rasayana along with Kshira Anupana. And many of the patients after chemo will have a loose bowel, which should be given with Vilvari Gulika, is the Rasayana in all forms. And the Tulasi in this will take care of all anti-cancerous property, even if it is being adjuvant or co-therapy, it takes partly it takes a condition of anti-cancerous action also. And pain abdomen with Chitrakadi and Shilkavati. Headaches with Patya Shadangam Kashayam, Patyakshadatri, Bhunimba, Nisha, Nimba, Amritayude. So all these 6 drugs. Then Phalatrikadi Kashaya, if the patient develops jaundice in between chemotherapy, there are many incidences where liver function goes abnormal while taking chemotherapy. And epistaxis, very, very common presentation when doing chemotherapy. So, Vasa Grita, if the patient is of Pitta Prakriti. Here, epistaxis, we should not take only epistaxis. Even cervical bleeding while doing chemotherapy is also very common. Durva Swarasa and Prabala Panchamrita Rasa, Chandrakala Rasa, these medicines we take care of. I'll give 3 cases of my own experience. This is case 1, a 39-year female nulliparous, and she consulted for infertility. She is HPV negative, still presented with multiple genital warts on her vaginal region, even anal region covered. We couldn't even see the labia. So CA 125 is raised and diagnosed with vaginal warts, and she underwent diathermy for twice. And it's a case of recurrent genital warts. So treatment plan was Ashoka Grita Snehapana. She was a medium built Kapapitta Prakriti patient. So I have given her Ashoka Grita for 9 days. After that, Nitya Lakshana was observed. And Nitya Virechana, I couldn't give her Virechana 1 day. So I have given her Nitya Virechana Dravya with Nishraka Sneha. She was taking Nishraka Sneha for almost 5 to 7 days. After that, Yoni Prakshalana with Panchavalkala Kashaya and Tankana Basma added to that. And Kshara Karma with Kshara sutra. For all the bigger warts, I have tried Kshara Sutra, and rest of the things I have done Yoni Prakshalana. After almost 21 days of treatment, I am very happy to explain you that she's almost like 99%. We ourselves couldn't find that she have been undergone such a treatment. Her labia is completely visible now, and her cervix is alright. And HPV, she is HPV negative, but presenting with all the symptoms. Viral load is high, but she is now completely fine. She is still consulting, and Arshohara Chandraprabhavati and Gandhaka Rasayana I have given her as an internal medicine. The next one is the 48-year-old female diagnosed as rectal carcinoma, the primary one. She was underwent colostomy, but with metastasis in cervix second time. So the treatment plan was Swarna Parpati with Kalyan Kshara and Avipatikara Churna as given. Dadimadi Grita for Muda Vatana Yomana. As the seat of the disease, it's Sila Apanasthana. And Dadimadigrita and Chirvilma, both are Apanavata Dushti correcting drugs. So Dadimadi will take care of restoring of the normal cells also, and the Kashaya Rasa will take care of Thambana, where the abnormal cancer growth is arrested date, and Kanchanara Gugulu does the same. Kanchanara Kapavatahara Dravya, where the rectal cancer, colostomy, the site is done. It is very fluidic and the exudation is very high. So I wanted to do Soshana there. So I wanted to go with Kanchanara Gugulu, and after 3 months, we have started with Kumari. So she was symptomatically responding, and she is responding good with less symptoms. And Kumari Asava Asoka Rishta with Chandraprabhavati was added later. And we withdraw the Grita, and presently she is on Varanadi Grita. Duration of 1 year, she is still going on, and not at all any symptoms were given. CA 125 is yet to be tested. She is yet to be tested for PET scan now. And the third case is very interesting. It is my first case as a practitioner. It's a 59-year-old female with postmenopausal bleeding, and she is diagnosed with CIL1 in pap smear analysis, and she is observed with gradual weight loss also. Patient is very alpha sattva patient. She lost around almost 10 to 12 kgs in 2 months. She is very much worried that she already have a cancer and she is going to die. This happened around 6 years back. And treatment plan was Yoni Prakshalana with Panchavalkula Kashaya with Tankanakshara and Yoni Pichu for 15 days with Panchavalkula itself. I soaked all Panchavalkulas in Tilataila for whole night, and I made it as a paste, and I made a vatti kind of thing with that Panchavalkula. And I have given as a Yoni Pichu for 15 days. Internally, I have kept her on Rasamanikia with Guruchi Sattva 40 days and Chandrakala Rasa Aragyavardhini for 3 months. And patient is stable since all these 6 to 8 years. Like she started consulting 8 years and treated for 1 year with all Rasayana Dravyas, Virechana Karma, all Rasayana is given. Tested normal pap smear every year till 2. So management is being incomplete. So uncertainty in understanding the stage of disease is the main reason, and lack of evidence through a scientific base, like as a statistical study, so many cases and before after studies, if we cannot produce in the same, so we cannot standardize the thing as per our own thinking. And clinical audits is the lacuna, wherein need for comprehensive and collaborative clinical studies is very much the need of the hour, but should be under the clinical parameters mentioned in Ayurveda, where we cannot put our legs into some other shoes and it's not fitting also. So the key to success is early diagnosis and periodical screening, and the better understanding of the prognosis of the patient and effective in-time management. Give a counsel hope and avoid over medication. If I say 10 number of anti-cancerous drugs mixing all together and giving to all the patients will never make any change. And sticking to the basic art science in framing Chikitsa protocol is very important. Thank you for giving me this opportunity. A little of my experiences I shared. Thank you so much.
Thank you, ma'am. It was wonderful presentation, ma'am. and with easy medicines you are treating. So all medicines are available in our clinic only. So you
Yeah,
are
definitely.
boosted our confidence also to treat the
Uh,
cervical cancer.
The
Thank
thing
you
is like
once again.
I presented only these cases which we can produce before after study, but many of the patients, the female patients, they come with the symptoms, and once the symptoms are gone and they are being stable, they never repeat pap smear again because it is a vaginal procedure and they don't want to be disturbed again privately. So many a patient will be completely fine, but pap smear post treatment is not available.
Okay. Can I take questionnaires now?
Yeah, sure, sure.
I requested delegates, they can raise the hand and unmute, and they can ask the question one by one. I think Dr. Geeta wanted to ask something. Dr. Geeta? Any other? Anyone wants to ask question?
So can you place your questions in chat box? Otherwise, you can unraise yourself.
Unmute and ask
Yeah.
the question.
Yes.
I don't
Dr.
see any.
Vishwanath sir?
Ah.
Dr.
Namaste.
Vishwanath sir?
Namaste,
Yes.
madam.
No.
Madam, what is Vamanamrita, madam? Is it something available pharmacy in from Andhra Pradesh? This thing, Vamanamritam, and one more yoga which you mentioned as Arshogna.
I will explain. Vamanamrita is available with Incorp Cooperative Society.
Okay. And one more thing which you mentioned was Arshogna Chandrika.
Vamanamrita
About him.
is a mode of action. It's a Pachana Aushadha. It's strictly Pachana Aushadha where you can give in a Agni cases mean after chemo and radiation therapy.
One question is in chat box.
Yeah,
Ma'am,
after chemo and
Dr.
radiation
Kavita is
therapy,
asking.
Ayurvedic treatment.
Yeah.
Yeah, definitely they can. And they should also, as per me, they should go through herbomineral composition after taking chemo and radiation because it is very dextrorotatory to the patient and very compatible to the patient to be on Ayurvedic medication after being so much exposure to the chemotherapy, which will have adverse effects on the body. So that can be maintained and balanced and even reversed by the Ayurvedic medication. Because the concept of Rasayana is only in Ayurveda. It's a very boon to Ayurveda that Rasayana can be done by Ayurvedic doctors. The post chemo and radiation therapy, that is Rasayana.
Yes, ma'am. You can.
Yeah, namaste, ma'am. It was a wonderful presentation, ma'am. And yeah, yes, you have completed almost all angles you have covered, ma'am. How to approach and what to do and what are the common medicines available, which are very simple and highly effective and very simple approach, not to jumble so much things, and you have made it very clear. Thank you so much for that, ma'am.
See,
One
actually, social fear about cancer is too much exaggerated, I feel. Because with our medicine, we are very sure that people very stable with Aristalakshana need not be treated at all. And patient with Alpha Sattva with lot many complication with Alpha Aristalakshana can be easily treated.
okay. So one like Bhallatika, how you are using, and in what context you are using?
Ballataka Vati we are giving in only 1/2 gram for twice a day. Ballataka Vati we are giving this.
So it is using, you are using as a Vyadihara
Yeah,
or as a,
it's a Vyadhipratineka Aushadha.
okay, thank you so much, ma'am. And what are the local treatments apart from this yoni, prakshalana and other things? Are you doing this cervical? Because when cervical erosion happens, have you done some other procedures?
In cervical erosion cases, we do along with Kshara. Or else the pichu will be in a different aushadha like Varanadagrita pichu, or we prepare Hingwadi Taila. My DC drug is Hingwadi Taila.
Okay, ma'am.
So Hingwadi Taila pichu we use it.
So in
Hingwadi Taila
erosion,
is Ratnavali for Kshinartava Dushti, where it should be taken Kshinartava Dushti in many conditions. Even in cervical carcinoma cases, there is Kshinartava Dushti.
Hingu
What
Tribunal.
about Dhupa, ma'am? Yonidu.
Dhupana we are doing in a conditions of just erosion, but carcinoma cases, I myself have not done Dhupana till now. When we were in PG in government college, they were doing Dhupana.
For cervical cancer, ma'am?
Even for HBsAg positive cases,
Okay.
they do Dhupana with a lot of exudate. So we do simple prakshalana and do Dhupana for the cases. Pichu is not recommended. Where is the Kledana Amsha is avoided in that condition.
Ma'am, you have mentioned Varti here. So, which Varti you are preferring for cervical cancer and in common disorders? Little diverting topic, but it is most needed. So,
That's
because
okay, but you are into the point. But you are into the point. The severity is high and dosha dosha samurchana is understood till the form of arbuda, apachi and all. Then the composition changes with, right? We take any bhasmas also. Or else if it is a simple condition, we will go for, as I said, panchavalkala along with tankana basma. Tankana basma is a very one rati, less than one rati we add along with panchavalkala and then keep it as a pichu, as a varti.
recently from last team we have made Vartis, ma'am, like Kafaja Varti and Pittaja Varti for leukorrhea cases and other vaginal conditions. Due to weather conditions, some of us destroyed because of fungal patching and other things. Have you tried any Vartis, ma'am? But some of our
But
practicing.
yeah, but Triphala Varti we are generally giving for all the patients. Like Triphala Varti is very commonly used.
For
Triphala
both.
Churna. Triphala Churna we soak it in Thaila
Okay, ma'am.
and make it as a complete Varti form with a gauze cloth pasted on that, and along with that gauze cloth we pack it as a Varti and then insert. Is a Triphala Varti very widely used.
You are not adding any. Which Taila, madam? Is it that Jatyadi or plain Tila Taila?
Plain Tila Thaila. Plain
It's a
Tila
plain
Thaila.
Tila. Okay, ma'am.
In
Thank you so much.
Kapha kind of condition, as you said, fungal infections, we give Kashaya Varti.
Okay, ma'am.
Since
And one more
Varti
Varti
you have
we
raised.
Pippaliyadi Varti. Pippaliyadi Churna we prepare for Vaishyajaratnavali represent. Pippali, Masha and Maricha.
Okay, ma'am. Masha and
Masha,
Mari.
Masha is taken in a bigger quantity because it is binding.
Okay,
With the
you made
permission
it.
of the chair, shall I add?
Yeah, please, ma'am. Please, ma'am.
Since the Varti Kalpana has come up, maybe way back in 82, 83, I started working on Varti Kalpana. See, as you said, if you do it with a liquid medium like water or some kashayams, chances of getting fungal infestation. But what I used to do is grita and honey.
Okay.
Oh, so make a fine powder of this Vastragalita Churna. And then whatever the drug you want to use, mix it and thoroughly triturate it further. And that you used to keep it, make the varti and keep it. When you want to insert it, or if you are dispensing it also, that can be smoothened in between the fingers. So the ghee melts and the whole varti becomes softened. So that could be used actually as a varti. Only drawback here is the whole varti will not be dissolved in the vaginal canal. So after 7 days, you'll have to remove it and give a prakshalana. But very effective.
Ma'am,
Because I have used.
Will have a retention and ropana capacity also. Thank you.
Because otherwise it becomes pichu if you are using a kashaya medium and do it.
Yeah.
So this varti is better. I have used with only Triphala. And since I worked in a government hospital, we used to get this kachu churna, the kadirasara churna, the fine powder, best tambaka it is, and here, ropaka, that you can use. And also sometimes, we used to give bhavana with whatever the kasha we want to give to the churna, then make a varti with this 2 medium.
Okay.
That is easy administration. And that you can beautifully put it like sachet, in a polythene sheet. And then only one varti they can take with a clean hand and then insert it. That could be done. Thank you.
Thank you so much.
Thank you so much, ma'am. So it has to be removed after 7 days, ma'am.
Huh?
It has to be removed. I did not.
Yeah, usually what happens, a little quantity of varti will be retained in the vault of the vagina. So the last day, you better ask the patient to use it for 7 days or whatever the period you want. So ask them to come on the last day and give a prakshalana. That's enough.
Okay. Thank you so much, ma'am.
Dr. Sribala, ma'am.
Namaste, madam. I have a very bad case. I just wanted to know whether I can go ahead with the case. She came to me last week with CA 125,700 something very high, and that too it's like wrongly diagnosed. Initially, she went for chemo. Last 2021, and she couldn't tolerate. She's 62 now. Then went for some Panchagavya treatment and didn't go for any kind of test. Now it is metastasis very bad, and everywhere. I think mild ascites, effusion, everything. But Sattva is very good. I just started with the because before the report I started the treatment, just this Hiraka Bhasma and simple this thing with Sukumar, as she had symptomatically Sukumara Grita, and now I got the result yesterday. So shall I go ahead with the Pallataka or something? But she's very strong. No, not much symptoms, only lower abdomen pain occasionally. But all the report shows the situation is bad. So I should continue with the symptoms or something like that.
Yeah, you can definitely go with Ballataka and Gandhaka Rasayana kind of. Rasayana Aushadha is very needful in this condition where CA 125 is very high. And clinical presentation.
Yeah, I thought I'll start with the clinical effusion, and I manage effusion and ascites, but nothing, even examination doesn't show any ascites symptoms, but it shows all these are in the report. So I thought of starting with the symptomatic treatment, and so only this. I mean, I was not sure whether to continue.
That again comes to her presentation like Kafaja Vikriti or whatever. It's a latent one.
Kaphavataja person, or more of Kaphavataja, and not much of Pitta symptoms she's exhibiting. So maybe that is the reason she's having good sattva.
Then definitely Varanadi will be the good choice of medication.
Oh, okay. Yes, ma'am. I have. That's what I started with Varanadi Kvata Churna. Boil. I told her to boil it and take it as it is. It can be freshly prepared and taken. So, okay, I'll go ahead with the treatment. I just wanted to.
Is very high and she underwent chemo, right?
initially she went for chemo, and she like one second chemo only she couldn't tolerate. She was very sick, and even doctor advised not to go for further, and they wanted her to come back, but she didn't go, and she's not interested in going back. And actually I had treated a case of CA some 2 years ago, and she didn't go one chemo. She came to me, she's just 45 now, she's fine. By seeing her, this lady has come, but she is in very bad condition. So
In that case, like you can start with Varanadigana Grita form, because after undergoing chemo, there will be a necessity of cell regeneration, and of course the
yes,
normal cells will undergo what to say, will be under threat with chemo and radiation, right?
yes.
So
Okay.
I am seeing some questions from Dr.
I'll
Ajit.
read it out, ma'am. I'll read it out. Okay.
Sadhana is more beneficial.
Thank you very much, ma'am.
Dr. Ajit is asking, which type of Shodhana is more beneficial?
It completely depends upon patient's prakriti, like, and the dosha samurchana as always. If
Madam,
it is Vata, of course, Vasti is the ultimate one. But Yapana Vasti as a whole could be given to all the patients undergoing chemo and radiation therapy.
Madam,
Of course,
Yapana Basti,
carcinoma are understood as the inflammatory disease. So,
Sorry to
non-inflammatory.
interrupt you, ma'am. Sir is asking something. Okay. Dr. Ajit, sir, you can.
Madam, Yapana Basti in the sense like rectally, or some people just like I heard Uttara Basti, but how it works, I don't know. How many days I have to give? That I don't have idea regarding Uttara Basti, because I am practicing only Basti, but I don't have any knowledge of giving Uttara Basti. So, how it acts and how many days we have to give, in what form, how to give Matra Bastis or Anavasana Bastis, that you guide me, madam.
Sir, do you mean to ask Uttarvasti in cervical carcinoma cases? I
No,
didn't get
madam.
you.
Usually endometriosis or any amenorrhea or any polyp or anything, whatever the uniopath related things. I heard many cases they are dealing with Basti like that, Uttara Basti. So, how we treat it's like any uniopaths, not only CA related things.
You mean
In
to ask,
general, it's asking Yoni Vapath cases, Uttarabasti
Yes,
indications, ma'am.
yes, madam.
see, Uttarvasti is indicated for any Vata Purishta gynecological diseases. Uttarvasti as good as the Vasti, but given it's a Sanika Chikitsa, so it will have 99% effect in treating the case. For example, if you have a endometrial hyperplasia,
Yes,
still
madam.
you want to go for Uttarvasti. And generally, people ask that just pushing the oil, it is a Brahmana Chikitsa, how you can do in a hyperplastic condition, right?
Yes,
The
madam.
mode of action of Uttarvasti is completely different. When you retain a certain quantity of oil into your uterine, we should push the oil into uterine cavity, retain it for some Vasti Pratyagamana Kala. What is the action does it give in that particular sthana, right? It's a Apanavata sthana with a highly circulatory area with the permeability into the local secretion
Yes, madam.
through the paracrine action. So there is an action called uterine first pass effect, which starts in the uterine musculature. There the pacemaker starts the action, and through which it is passed to the hypothalamic pituitary ovarian axis and give the signaling from that, and the release of GnRH is promoted through the signaling of this particular medical substance. The action of Uttarvasti goes to pituitary gland, and the action of medication locally does the anti what the action we meant for that particular use. So we choose for the that particular medication in Uttarvasti.
Thank you, madam. And one more thing is, like you have mentioned, Nitya Virechana kind, up to giving Ashoka Gratha, and like it is like Gratha giving, it is like Shamana or like Aruna type madam. How we have to give Snehapana in that way? So,
Sorry, can someone modulate that? I can't hear the question properly.
madam, you have mentioned in your protocols like Nitya Virechana you have given, no? So before giving Nitya Virechana, like Ashoka Resha you told, like Ashoka Grata you have told.
Nitya
So,
Videshana with Mishrita Sneha is being given.
Gratapana, how you have started, madam? Gratapana.
Mishrita Sneha itself is a Virachanakari also.
No, madam. Ashoka Grata you told, no? In some treatments, like
Ashoka Grata for Virachana used.
No, ma'am. He
Snehapana.
is asking
Snehapana.
daily basis we should give the Grita Nitya Snehana. Is must he is asking. Or else you are giving in the Arohana Avarohana Krama.
No, I have given for the patient as a Vicharana Sneha, like in a small doses for a long time. You can give in Arohana pattern, no matter.
Okay, ma'am. Thank you.
Excuse
One more.
me.
Hello.
If the
Yes.
Grita Snehapana, if you are giving for Shodhana purpose, it should be Arohana. If you are giving it as a Vadhi Pratirika, then the dosage, you fix it and give it for a long time. And in that case, she mentioned was, as I understand, Gritapana was done, but as she was not, suitable for Virechana, she gave Nitya Virechana for 7-8 days, I think. Is it
Yeah,
Dr. Sribala? If I remember, yeah.
yeah.
Thank you.
Thank you, madam. Thank you for your valuable session. Thank you so much. Thank you.
Welcome.
Thank you, ma'am. Ma'am, Dr. Halamma is asking, are you treating along with modern medicine?
No,
Cervical C.
Dr. Halam. Sorry, ma'am, we are not aware of it. If we need such an allopathic treatment, we just refer to a good center. But we never practice modern medicine because we are not specialized for that.
Dr. Kavita is asking, what is the life expectancy if diagnosed with stage 2 without metastasis?
Without metastasis, we can definitely, it depends on the prakriti of the patient and the sattva bala of the patient. As I said, all the 10 factors. If all are positive, she can live happily till her life expectancy, like for more than 5 to 8 years or 10 years. I have seen cases, as I said, CIN1 without metastasis, she is still doing good without any medication even. She's
Dr. Dilip Kumar is asking, ma'am, do you suggest surgery as first line of treatment for cervix CA to avoid metastasis?
Surgery is not first line of management even for the modern doctors also. So I would not personally suggest any patient as a first line of management as surgery. But we have to go all these, what to say, Shamana, Shodhana, Langana, from all kind of Shodhana. After Shodhana, even if it is not responding, then we have to go for Kshara Karma, Agni Karma, then go for Chedana Vedana.
Dr. Alama wants some clarification. Ma'am, I am asking, are you giving our medicines along with allopathy medicine?
Yeah, if the patient is under some medication, as a co-and-adjuvant therapy with their consent, we are giving because they don't want to stop the allopathy medicine. We do suggest them, you need not take or need to take whatever it is. Along with this, we are suggesting medicines of Ayurvedic system.
Dr. Ani, you
One
can.
second. Just a minute, Geeta. Yeah, ma'am. It's my question actually. Because cervical cancer, if we treat, if we remove the organ initially, so metastasis can be avoided.
No,
It's not. Yeah, ma'am.
no. Breast is a secondary organ. There are
Okay.
98% chances that patient can be diagnosed with breast cancer in future years. So removing the organ is not complete solution according to me.
Yeah, ma'am. But if we can remove organ and further we can treat with our system of medicine.
If the
So
patient is severely in fourth stage metastatic condition, if the surgery is the only chance given to them. Then, as you said, they're going to go for surgery for now. And in post-surgical management, they can take Ayurvedic medicine.
But not in the first stage, ma'am. Not in the first stage. First stage
When,
of the cancer.
when to avoid the surgery, you are asking?
No, ma'am. For surgery to avoid the metastasis. This is my question. And I know that, like, yeah. So nearest organ.
Yeah. To avoid the metastasis, also our medicine is working, but not in all the cases. Some Vata Prakriti person and with many other co-complications with liver function abnormalities and all, we definitely will have a poor response, and we don't want, if we don't want to have an ambiguity on the patient, we just ask them to go for surgery.
Thank you so much, ma'am.
Thank you, ma'am. Dr. Rani, you can unmute and ask.
Hello, ma'am. My question is, there was a mention about using of chemicals in the form of the chemical pesticides and fertilizers, and the chemicals found in sanitary pads and vaginal washes, etc. So, if the etiology of CA cervix is that, how are there any clues to identify the involvement of such chemicals, and how does our treatment help them wean off those kind of chemicals? Because that will be the reason for the cancer itself, isn't it?
Yeah, good question, ma'am. It's a need of the hour to raise this question. See, our sanitary napkins made completely, 80% of polythene.
Mm-hmm.
So, the interleukins emitted by them into the body through the permeability of the skin is very high compared to any other plastic substances we use. So there was a study, there was a survey study with the people using normal cloth napkins and soft cotton pads, and with comparative study with the people using this disposable sanitary napkins. So it was found that through Cancer Association, they strictly suggest that to change the pad for every 2 hours without making it is too soaked with the vaginal bleed or any other vaginal secretion. So once it is wet and soaked and loaded, it emits a lot of interleukins into the body. The other one which you asked is fertilizers and pesticides. It's a direct oncogen. It's a powdered oncogen that we cannot actually find it out when we cook it or when we actually see it. On grapes and all we can find it out, but otherwise we cannot literally find it out. So we have to, now we are suggested to wash the vegetables and whatever we get it outside in the market, we have to wash it in a warm water along with the salt, then dry it for some time, then eat it. Or else, if it is possible for you, make sure that you are eating organic food every time, grown without any fertilizers and pesticides on that.
Have you seen any cases who have continuously used vaginal wash and they come
We
with
have been to Prema Samajam hostel. We have been to Prema Samajam hostel with young girls. So we are being said to explain about menstrual hygiene and all. So there is a cancer center nearby, and it's an incident that one of the oncologists, she was speaking to me. So their oncology center had a study that food they eat, which is cooked right before and from microwave ovens and tin based foods, cancers from the higher economical condition. Generally, cervical cancers, they think out of UTI or poor hygiene and all. And if it is a genetic factor from familial things, but without all these possible factors, they are being diagnosed for taking junk foods and fertilizer food long time. And once it is completely stopped to the center, and they found no cases out of it. This is a study for almost 48 years there. From their information, like out of my 10 years experience, I am associated to them in Vishakhapatnam. So that information is shared in this presentation.
Okay, ma'am. Ma'am, one more question, ma'am. If the ladies who have got their hysterectomy done, so are they exposed to cervical cancer? Like there are the foreigners who remove their breast tissue because I said it's a secondary tissue. So there are some people who have a genetic reason that they will get it removed and expecting that they will not get a breast cancer. So does that apply to CA cervix as well? Like if they have removed a part of cervix during the hysterectomy?
If they have any genetic predisposition and if they have any vulnerability, it's better they will go any Rutu Shodhana and keep taking Rasayana therapy of Ayurvedic medicine and keep on checking themselves. Periodical screening and early diagnosis will definitely save them. It's not very mandatory that every person with genetic predisposition will should have a cancerous effect later.
Okay, so I thought I'd just ask that question as an extension of what Shakuntala ma'am asked. Like removing that part, will that removing the part itself will prevent? Was my doubt.
Yeah, yeah. Removing the part is the first step, and taking the what to say, as I said, the Rasayana therapy is the next step to maintain the life.
Okay, ma'am. Yeah. Thank you, ma'am.
Thank you.
Thank you, ma'am. Dr. Shubhashni saying, ma'am, usually in fourth stage, that is in metastasis, surgery is not recommended.
If the age do not permit and anesthesia complications are expected, then surgery cannot be done. In that cases, as I said earlier, Rasayana Aushada, Rasa Aushada along with Panchakarma, Kshara Agni Karma will take care.
Thank you, ma'am. Any more questions?
I want to add on to Sribala ma'am answer. Like for 5 years back, I diagnosed with hypertrophy without ATPia, and one of the gynecologists told me that within 6 months you will end up with ATPia. Better to go for surgery. Then another gynecologist I consulted, he told if you remove this organ, that's why I raised this question. If you remove this organ, it may spread to another. That what you said similarly, ma'am. I think Annie, this completes your question answer. So I have not removed my uterus, and I have maintained my dinacharya and rutucharya and other Ayurvedic shamaka medicines, and then that hypertrophy also went away. So I think Nitya Shodhana and with our medicine we can prevent this hypertrophy, and even we can avoid surgery and we can avoid in first stage also.
Okay, ma'am.
Thank you.
Ma'am, one more question. Dr. Vishwanath sir asking. In present trend, there is usage of menstrual cups. Is it better than sanitary pads in context of CA? What's your suggestion?
Is somewhat better than sanitary napkin, but it is also a silicone, not completely a natural one. Still, the study for next 100 years goes on. We cannot find cons of that. Now that it can be understood as pro than sanitary napkins, as you said, definitely.
Dr. Girija is asking, is HPV vaccine is really beneficial, ma'am? If yes, how many doses have to be taken, or is it okay to deny it?
See, it is not mandatory that every HPV vaccinated woman will be positive in future. There is a notion that HPV after taking vaccination, many people are being positive for cervical cancer. It's not so. 3 doses of inoculation in reproductive age of women is almost like arresting the cases cervical cancer, definitely.
Ma'am,
But as per our study, we do not suggest anyone to take HPV vaccine. We suggest only Nitya Shodhana and Rutu Shodhana and Rasayana Dravyas. It is more powerful as far as the HPV vaccine.
Thank you.
But initially, that trials shows that many girls were died due to that vaccine. It was a
Yeah.
uh,
Earlier fourth clinical study said that early age should not be given. At very younger age, it should not be inoculated.
no, ma'am. When they have started, na, initially that trials, HPV vaccine trials, no, they have done in Andhra Pradesh itself, and many girls are died because of that vaccine reaction itself. This was the actually report I read long back.
It was there earlier. It was actually proposed in such a way that people underwent HPV vaccination are more diagnosed with cervical cancer.
Is it now modified or how, ma'am?
But HPV is not a live inoculated vaccine. The study is going on because it is not approved with a 100 people study and the RCT trials and all. But
Thank you
as
so
per our understanding, we also say Sasmita of the body, right?
Yeah.
We don't know 3 doses, how much doses they give, and what is the compatibility of the patient. The modern people don't have the concept of dhatu and prakriti of the body. So as per their understanding, is for 1,000 cases, how much number of cases are being positive and negative. So for us, if a medicine is inoculated, the response should be in different way, in a different prakriti of the body. So study should be in that way to at least determine whether the vaccine is safe or not.
Thank you so much, ma'am.
Thank
So,
you, ma'am.
alternate, ma'am, like for pads, sanitary pads, because that is nowadays there is no other option like whatever we are getting into the market.
See, tampons are better because they are cotton knitted, and otherwise, again back to the thing, whether
Yeah,
very clean cloth or else now that cloth made sanitary underwears and napkins are available now, which
Yes,
are
ma'am.
washable and reusable.
Thank you
Thank
so
you,
much.
ma'am.
Yeah.
Dr. Hemalata ma'am is asking for the diet, madam. Madam,
Sorry,
suggest
diet.
the diet. Diet.
Oh, diet. What should be taken as anti-cancer?
Yes.
Diet in the particular sense, we see only preventive thing to not to take any pesticide and fertilized induced foods. But otherwise, we know the dosha concept, right? In a Vata Prakriti person, Snehana is important. The Thailam Gritam Madhu is Sadapatyam for. In Vatam it is Thailam, in Pittam it is Gritam, and for Kapha it is Madhu. And regular practice of taking seasonal fruits and antioxidant therapy with good rich green leafy vegetables and milk nitya rasayana should be advised to the patient along with the specific prakriti kind of diet regulations.
Ma'am, thank you, ma'am. Dr. Anand sir is asking regarding Suvarna Yoga's help in prevention and cure.
Yeah, it's a very good thing. Like Swarna is very good noted as a cell regeneration capacity medicine. So I mentioned Vangabhasma. At the same place, Swarnabhasma is also used if the patient is with any apoptotic conditions in neuroendocrinological tumors and all. In such cases, Swarnabhasma is doing wonders.
I think all the doubts are clear. Okay. Now we'll go for the vote of thanks. I'll call Dr. Archana ma'am for the vote of thanks. Dr. Archana ma'am.
Namaste, ma'am. Namaste and good evening, everyone. Thank you would be a very small word for today's presentation, actually. Uh, in spite of that, it's my duty. On behalf of RAAOUS organization, I extend my heartfelt thanks to our guest speaker today, who has spared her time to grace this occasion. It was an absolute pleasure listening to you, madam, because the presentation was so simple and I felt it is ready reckoner actually. So you have shared your valuable insights and experience. Thank you for all the information you gave us today. And as Dr. Amulya mentioned, we hope to get to listen to you again in the same platform with a different topic, and all will be eager to listen to you. Thank you so very much, ma'am. Thank you for gracing the occasion. And we know no attendees, no event, right? So today's session was made wonderful, and the interaction was so enriching because of one of our prominent white hair, that is Dr. Jayashree ma'am, who gave her knowledge and shared her experience. Thank you, Jayashree ma'am, for gracing the occasion. And I thank all Vaidyas for making this seminar a success. And it would be very incomplete if I don't thank Dr. Shakuntala Patil, madam, founder of our organization, who selflessly has given us this platform where we can share knowledge and we work together to make a better society. Thank you, Shakuntala Patil, madam. And a special word of appreciation for our team, Dr. Geeta, Dr. Veena, and Dr. Amulya, who were part of today's session, who made it very smooth. That is, the execution of the seminar was very smooth, and this session was very inspiring and enriching. I thank wholeheartedly the guest speaker, the invitees, and all the Vaidyas who were here. Thank you very much. And let us all look forward again to meet here and learn, enrich our knowledge, and make a difference in the society. Thank you. Have a great evening, all of you.
Thank you so much,
Thank
ma'am.
thank you. Thank you.
Thank you so much, Mano, once again.
Thank you, Jayashree ma'am.